In this video, I'm going to show how to get rid of a pinched nerve in the lower back. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over really easy exercises that are going to quickly take pressure off pinched nerves, allowing them to heal faster. These exercises are perfect for targeting bulging and herniated discs in the lower back, the main cause of sciatica and pinched nerve pain. Just as a quick note, each one of these exercises works differently. They're going to be shown in different positions. To get the best results, go through them all and use what gives you the most relief. With that being said, let's get started. So here's a really good exercise that we can do in bed or on a floor. With this one, we're going to start with a pillow underneath our waist, and then we're going to support our upper body weight on our forearms. Mine are roughly in a V and I just put my hands together. So it's really important to note how you feel in this position. If you notice any more back pain or sciatica, please discontinue immediately. This one is not for you. But if you do notice that you're getting relief, at that point, hold it for about 2 to 3 minutes, longer if it does feel good. But during that time period, just do nice, slow, controlled breathing. Relax into this one. So to take this position to the next level, hopefully get some more relief, we can add a little bit more of a stretch in there. So we're going to take the pillow out, and this time around, we're going to let our hips and pelvis lie flat on the ground or the bed. It's really important not to lift up with this. Make sure that your hips are glued to that bed. And we're going to slowly press our shoulders and chest upward towards the ceiling using our arm strength. When you do this, you're going to feel a little bit more of an arch in your lower back, creating a deeper stretch. Go to the point where it is a deep but comfortable stretch, and now you want to hold this for 30 to 45 seconds. And again, just do that nice, slow, controlled breathing. Relax by lowering your chest towards the floor, and then repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. So to get a deeper stretch, you can do what is called the cobra. It's very similar. This time around though, we're going to put our hands right off to our side by our shoulders, tuck our elbows towards our side, and you're going to just press your shoulders and chest upward towards the ceiling, again keeping your hips flat. Build into this one, hold it for 30 to 45 seconds, release it, take a breather, repeat this 3 to 5 times. But if you would like to modify this position, hopefully get some more relief, what you can do is instead of keeping your upper body straight, tilt it a little bit towards one side. So I'm going towards my right, and then I'm going to repeat. You're going to notice that it opens up the lower back just a little bit differently. Give that a try towards the right and also towards the left. If any of those positions offer a little bit more relief, keep throwing repetitions in until everything is nice and loose. Here's an exercise that we can do seated. Whatever side that you have the most pain or sciatica, let's say it's our right side, you're going to straighten the leg on that side, put your heel on the floor, toes up towards the ceiling. Other leg just stays bent like this. So let's have very good upright posture. Just have your back nice and straight. From here, you're going to take your foot and now slowly press it away from you, kind of like pressing into a gas pedal. As you do this, you're going to feel a really good stretch form from your lower back that works across your hip, down the leg, all the way towards your foot. This one stretches that whole sciatic nerve pathway. You're going to hold this comfortably for a second or two, release it, and now bring your foot back towards you. You're going to feel that stretch a little bit differently. Again, hold this one for a second or two, release it, and then as a fluid movement, you're going to press away and towards you over and over again for 15 to 20 repetitions. And with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If it's really helping out, you're more than welcome to throw in as many repetitions as you like. And if you do have pain on both sides, you can do this on both sides also. So let's take this one to the next level and focus on a couple more muscles that are highly associated with pinched nerves and sciatica pain. So for this one, whatever side that you're having the most pain or discomfort, again, let's say it's our right side, you're going to take that side's ankle and place over your other side's knee. So when you look down, it should look like a figure 4. The first movement is taking this bent knee and slowly pressing it down towards the floor. but don't use your hands. Instead, use your leg and hip strength, because the more that you press down, the more that you're going to feel a deep activation in the muscles around the hips, targeting the glutes and the piriformis. So we're going to build into this one, hold it comfortably for 5 seconds, release it, take a breather, and then repeat this 10 to 15 times. Again, with each repetition, try to build into it just a little bit more. So another movement in this position that will offer a really deep stretch and hopefully take pressure off a pinched nerve is by taking your hands, cupping around your knee, and now slowly pulling this knee across your body towards the other side shoulder. When you do this, you're going to feel a really deep stretch form on the outer part of your thigh that works across the hip into the lower back. Build into this one, hold it for a little bit longer, more about 30 seconds, release it, and then repeat this one 3 to 5 times. But go through all of these movements. You're probably going to find that one just offers the most relief, and at that point, keep throwing repetitions in. And if the other side doesn't hurt, I still recommend throwing a couple repetitions in on that side just to keep everything nice and loose. Here's an exercise that we can do standing, and all we're going to need is a wall. The hardest part about this exercise is just knowing which side to place closest to the wall. Remember, whatever side that you have pain or sciatica, you want that side facing away from the wall. So I'm going to demonstrate what to do if you have left-sided issues. You're going to put your feet together, spaced roughly a foot, foot and a half away from the wall. Bend your elbow at 90 degrees, tuck your arm off to your side, and now lean your body weight into the wall to the point where your shoulder, elbow, and forearm are flush against it. It's really important during this exercise not to lift your shoulder off the wall. Instead, all movement comes through our hips. Take your hand, place it over your hip, and now slowly press your hips towards the wall. Do this slowly because you are going to feel a deep stretch form in your lower back. This one helps quickly take pressure off a bulging disc that might be pinching a nerve. So at that point, if you notice any improvement in your pain or sciatica going down the leg, definitely build into this one. But if it's the opposite and you feel more, discontinue immediately. It's not for you. But keep pressing into the point where it's a deep but comfortable stretch, and now you want to hold this for 30 to 45 seconds. And during that time period, just do nice, slow, controlled breathing. Let that tension out. Release it, take a breather, and then repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. So to deepen this stretch, all you have to do is walk your feet further away from the wall. But let's take this one to the next level and do another movement called standing back extension, hopefully get some more relief. So for this one, I'm going to start with my feet slightly wider than my hips, and then take my hands and place them around my belt line. Your thumbs are going to press right into the muscles off to the side of the spine, and what you want to do is slowly press your thumbs into those muscles into the lower back while your upper back and shoulders lean backward. You're going to feel more of an arch in your lower back and a deeper stretch. So build into this one, hold it comfortably for about 5 to 10 seconds, release it. On the next repetition, raise your thumbs up slightly, maybe an inch or two, and then repeat. You're going to notice it stretches the lower back a little bit differently. So repeat this the whole length of your lower back. The odds are you're going to find that one certain spot just offers the most relief. At that point, I stop in that position, build into it, and now hold it for longer, more about 30 to 45 seconds, release it, and then repeat this 3 to 5 times. But go through all of these movements and focus on the ones that offer the most relief. So here's a decompression exercise that we can do in bed. Think of a deep opening stretch in the lower back that quickly takes pressure off bulging and herniated discs and off those pinched nerves. So we're going to start by placing a pillow right at the edge of a bed, and we're going to lie on our stomach right over that pillow so it's supported over our waist. You're going to have your legs going straight down towards the floor, so your knees should be pointed towards the floor, bent roughly at 90 degrees, and rest your lower body weight onto your toes. Your arms go straight ahead just like this, and we're going to slightly tuck our chin towards our chest. In this position, you should start to feel gravity pulling your leg weight downward towards the floor, opening up your lower back. It usually feels really, really good. Try to relax into this one as much as you can, and then hold this for 2 to 3 minutes, longer if it feels good. But during that time period, just do nice, slow, controlled breathing. Let that tension out. To take this one to the next level and get a little bit deeper of a stretch, what you can do is take your fingers and crawl forward like this until you feel a really deep but comfortable stretch. You can also start to tilt your body towards one side. So tilt a little bit towards your left and also towards your right. If you notice any of those positions are offering a little bit more relief, at that point, spend more time in that position.
So let's end the video with a really good strengthening exercise that you can do daily that will build more support around the lower back and help a bulging or herniated disc heal faster. So for this one, we're going to lie flat on our back in bed or on a floor. Have your legs roughly hip width apart, knees bent, feet flat. The first thing that you want to do is take your hands, put them right on your hips. We're going to do what is called a pelvic rocker or a pelvic tilt. So for this one, we're going to imagine our tailbone right here, and what you want to do is scoop it up like this, curling it towards your belly button. As you do this, you're going to feel that your pelvis and hips start to rock backward, but more importantly, a really good stretch will form in your lower back. Build into this one until it is a deep but comfortable stretch, and now you're going to hold this for a second or two, release it, and now go in the other direction. So here's our tailbone. This time around, we're going to scoop it and press it downward towards the bed or the floor, and you'll feel that your hips and pelvis start to rock forward. A little bit different of a stretch, but again, hold this one comfortably for a second or two. You're going to release it, and then as a fluid movement, you're going to rock backward like this and forward 15 to 20 times. And with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If this one is offering a lot of relief, you're more than welcome to throw in another set or two. But now let's focus on our strengthening and take this one to the next level. So for this one, we're in the same position. We're going to take our heels and gently press them down into the bed or the floor until we feel a light activation of the glutes or the buttocks. At that point, we're going to hold this, put our hands back onto our hips, and we're going to slowly raise our hips upward towards the ceiling until our knees, hips, and shoulders are roughly in a straight line. So you're going to feel a lot of muscles start to fire. The core, your lower back, your butt, your legs, everything that helps support those spinal discs. We want to hold this for 5 seconds. We're going to release it, take a breather, and then repeat this 10 to 15 times. Again, with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or two.
If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below and I'll get back to you as soon as I can. Thanks for watching.